Hello, and welcome to Front and Centered with me, your host, Patrice Charlotte, Communication Specialist for Equity and Community Health. As always, we encourage comments and questions, and we'll have a dedicated Q&A at the end of the presentation. We ask that you save questions until the end and submit them by using the Q&A button located at the bottom of your window. Should you have any comments, please feel free to put those in the chat. Live transcript is also available. To turn this feature on, please click on the CC button at the bottom of your screen. We have a very special program for you all today. This afternoon, we'll be hearing from Doctors Fiona Danaher and Rashmi Jasrasaria, and Immigrant Health community health worker, Marcia Burgos of the Center for Immigrant Health, who will show us that there's much more than meets the eye in the often politically charged conversation about newly arrived migrants. And so without further ado, it is my pleasure to pass it off to today's presenters, starting off with Dr. Fiona Danaher. Fiona, take it away.
Thank you so much, Patrice. We're so grateful to have the opportunity to share the MGH Center for Immigrant Health's work with everyone here today. Next slide, please. So as many of you, I'm sure, are aware, migration is on the rise all around the world right now due to conflict, poverty, and climate change. Many of the images on your screen may look familiar from media coverage of the increase in asylum seekers arriving at the US southern border and refugees arriving from Afghanistan and Ukraine. But the United States has always been an immigration destination, as we know, and Massachusetts is absolutely no exception. Our state has the second highest net international immigration rate in the US after Florida. 1 in 6 Massachusetts residents is foreign-born, and 1 in every 3 Massachusetts children has at least one foreign-born parent. Right here in Boston, more than 1/3 of residents speak a language other than English at home, and that number is even higher than 50% in the communities served by our health centers in Chelsea, Everett, and Revere. Next slide, please. New arrivals to our state captured particular media attention in September when approximately 50 migrants from Venezuela and Peru were flown to Martha's Vineyard as part of a political stunt. But the numbers of new arrivals in Massachusetts had already been increasing for months, with more than 2,000 migrants estimated to have arrived between May and August alone, particularly from Haiti and South America. Next slide, please. Our experiences in Mass General Brigham's emergency departments, urgent care centers, and obstetrics units, which are often a first point of contact, have borne out this trend. While we continue to see increases in the immigrant populations historically cared for in our catchment area, such as those from the Northern Triangle countries of Guatemala, Honduras, and El Salvador, we are also seeing significant increases in new patients from Haiti and South American countries who may have fewer connections in the area. For example, the MGH Center for Immigrant Health was recently called to assist when 2 Venezuelan families with young children arrived to the emergency department. They had been bused from Texas to Boston via Washington, D.C., but when they arrived here, they had no money, no one to call, and nowhere to go. They slept in South Station until the children became sick, and one of the infants ran out of formula. The children's antibiotics and inhaler had been confiscated at the border, as had one family's birth certificates, making it challenging for them to qualify for family shelter until we assisted them in contacting a consulate. Next slide, please. We are incredibly proud of how the Mass General Brigham community has stepped up to support these new patients. In September, the MGH Center for Immigrant Health coordinated with MGH Chelsea Healthcare Center, MGH Global Disaster Response and Humanitarian Action, the MGH Asylum Clinic, the Spanish Language Care Group, and our incredible community partners at La Colaborativa and the Chelsea Public School District to host a new migrant welcome clinic. The event served as a one-stop opportunity to connect families to nutrition resources like WIC, free legal consultation, housing support, know your rights education, and medical care. Thanks to the hard work of the many dedicated staff you see here, numerous children were able to receive their vaccines and enroll in school the very next business day, smoothing their adjustment to life in the US. Next slide, please. We recently held a second new migrant welcome clinic with the same partners, but with the important addition of the MGB Community Caravan. This event served more than 24 new migrant families from 8 different countries. We anticipate holding additional events in the near future. Next slide, please.
Thanks, Fiona. Migrant patients have many unique healthcare challenges, including but not limited to limited English proficiency or language access, as you see on this slide, immigration status and legal challenges, and navigating a complex healthcare system. We saw this play out prominently during the first surge of the COVID-19 pandemic, when 41% of people admitted to the MGH with COVID-19 spoke a language primarily other than English, as compared to the pre-COVID average of less than 10% of inpatients. A study published in Health Affairs in November of 2020 also found that the proportion of foreign-born non-citizens was the strongest predictor of the burden of COVID-19 cases within a community. And in Massachusetts, this population includes sizable numbers of both Latin American, about 45%, and Asian individuals, about 30%. The disproportionate impact of COVID-19 on our immigrant populations accelerated the timeline for establishing the MGH Center for Immigrant Health, which formally launched in December of 2020, with interdisciplinary input and Dr. Fiona Danaher at the helm, and representation from across multiple MGH departments and the community, and with support and leadership from MGH Equity and Community Health. The center was established to serve as an institutional virtual hub to foster excellence in clinical care, education, advocacy, and research aimed at improving the health and well-being of immigrants. Not only immigrants amongst our patients and surrounding communities, but also immigrants amongst our staff. Here is a photograph of Senior VP of Equity and Community Health, Dr. Joe Betancourt, standing with the butterfly wings that have been on the Bullfinch lawn at MGH during the past 2 Decembers to celebrate our Migration is Beautiful campaign. The goal of our virtual center is to be a hub to ensure that MGH staff are equipped with the knowledge and resources to meet the needs of immigrants, regardless of their immigration status. We work in several different streams, as you can see here: resource navigation, clinical programs, education, advocacy, quality improvement and research, and inclusivity, mirroring the pillars of the MGH mission. Through our clinical programs, we want to support clinicians, especially in providing standard of care to their immigrant patients. We do this through our resource navigation program, led by our community health worker, Marcia, who is on this call, a medical legal program where we brought together different people amongst our health system who do involvement in medical legal partnerships, through accessing durable medical equipment. And this year, we will be piloting a mental health program by hiring a social worker and also a food and nutrition program. In the education space, we have done multiple presentations on best practices and have created badge backers that providers can use to remind themselves of the best practices of working with immigrant families. And we aspire to continue with advocacy, not just at the hospital level, but at the city and state and federal levels. In quality improvement and research, we've partnered with the obstetrics and gynecology department to do work on gender-based violence, and had a grant from CPIP to do some work, from eCoach, sorry, to work with the CPIP program and look at mental health access. And Dr. Danaher will talk more about the Migration is Beautiful campaign. I want to focus a little bit today on our pilot program in mental health. As you all know, access to mental health services has become increasingly challenging at the national and local level, and was exacerbated by the pandemic, where one article even called the country's mental health crisis a pandemic within the pandemic. This lack of access is especially true for our migrant patients who face additional barriers, as I've already described. And sometimes they have really long wait times for psychiatric care, which can lead to poor mental health outcomes and emergency room visits that often re-traumatize patients and their children, especially who have experienced family separation or immigration detention. One of the main goals of the mental health program is to improve and increase access to mental health services and hopefully fill in the gaps by providing some short-term mental health services as a bridge to care. We based our model on the fact that immigration resettlement is actually at the base of and plays a very significant role in mental health outcomes. I'm going to now let Marcia Burgos talk a little bit more about her role as the community health worker for our program in this resettlement, which is really the foundation, again, to this pyramid of acculturation, trauma and isolation, and eventually psychopharmacology.
Thank you, Rashmi. It's very evident to me as an Immigrant Health CHW, having worked with over 200 families over the past year, that the survival of immigrant patients depends on the community resources, hospitals, and CHWs. Being part of a strong community that supports with resources is essential for the well-being of newly arrived. For example, I try to connect my patients with basic needs, which include healthcare, food, shelter, job assistance, and legal support. Having these basic needs also provides the families with a sense of security and safety. Empowerment, which is the middle of the pyramid that you're seeing right now. Once I've been able to address one or more of their fundamental needs, I strive to empower them to continue standing up for themselves and to form a support system, a network with families and friends to help them overcome the challenges of everyday life by embracing their resiliency and never giving up. Stay informed, which the pyramid shows self-fulfillment needs. When I'm almost done completing a referral, I advise my patients to keep in touch with the services offered in the area, to take advantage of every learning opportunity, and to keep speaking up for themselves and other members in the community because a strong community supports everyone's success. And before moving on to my next slide, I would like to highlight what the Center Immigrant Health has accomplished so far as 2022. We have completed about 200 referrals. The main reason for our referrals have been 54% to connect to care, 15% for mental health, 23% to traditional social determinations of health, and 70% to legal services. Next slide, please. I would like to discuss best approaches to working with immigrant families, including what I've learned and what I would like to share with you. Listen to concerns, provide empathetic and patient-centered care by listening and addressing fears and concerns, and walking families through the process of applying for health services and other resources. Reinforce confidentiality. Many immigrant families are fearful of sharing personal information and working with individuals who are in positions of power. It is important to make clear that the personal information provided is confidential and that it can only be used to determine eligibility and access to care. Avoid documenting legal status unless absolutely necessary. Avoid using words like undocumented in the patient's chart. Use other words like new arrived or newly arrived. Be mindful of the language you use. People are not the immigrant status. Avoid using terms like illegal, dreamers, or DACA kids. Prefer language. Be prepared with application forms and other documents in the patient's preferred language. Remind them that they have the right to ask for a medical interpreter when they are in a medical setting. And never to use family or friends. Now I would like to pass it to Fiona.
So thank you, Marcia. We have lots of opportunities for employees to get more involved in this work. The MGH Immigrant Health Coalition, which was established in 2018, is a multidisciplinary network of more than 260 MGH employees committed to improving the health and social equity of immigrants. We meet monthly and maintain an active listserv to share resources and advocacy opportunities. And you can join the listserv by emailing the address you see on your screen, which we'll share in the chat as well. Next slide, please. Each December, the MGH Immigrant Health Coalition hosts a Migration is Beautiful campaign, as Rashmi mentioned, to coincide with the United Nations International Migrants Day, which falls each year on December 18th. We celebrate our immigrant patients and colleagues, and we share best practices to keep our institution as welcoming as possible to people from all walks of life and all corners of the globe. Next slide, please. As we work to welcome the newest members of our community, we celebrate our diversity as our strength, and we remember our founding credo that when in distress, every man, woman, and child becomes our neighbor. No line on a map alters that commitment for us. If you'd like to learn more and support these efforts, you can visit our website at massgeneral.org/children/immigrant-health. We'll put this in the chat. You can sign up for the Immigrant Health Coalition listserv, as I mentioned, or you can scan the QR code on this screen to visit our fundraising page. Thank you again for having us and for all of the incredible care that you provide to immigrant patients every single day, and we'd be happy to open it up to questions.
Awesome. Thank you so much, Fiona, Marcia, and Rashmi. Like Fiona said, we'd like to now open things up for Q&A. As a reminder, to submit questions, please use the Q&A button located at the bottom of your screen. In the meantime, we did receive a few questions beforehand, so I will just get us started. So the first question is actually for you, Marcia. Marcia, can you talk more about the process of a newly arrived migrant working with you? What types of services do you offer?
Sure, I can talk about my process of working with newly arrived immigrant families. It's different for every family, but I introduce myself, I explain my role and my purpose. I ask for the permission to further support them and to connect them with other resources outside of the Mass General or MGB. I make sure that they are connected, with health insurance, because it's very important. Especially because they're coming for care, and for many others, reasons as well. The process of connecting health insurance is very important and very beneficial, especially when connecting them with other resources, including like emergency housing. And the services that I provide is resource navigation, case management, educating and partnering with other departments throughout the hospital system to ensure that the immigrant patients can safely access needed resources.
Awesome. Thank you so much, Marcia. We actually have a question for you, Rashmi. So Rashmi, often we hear from providers about the challenges associated with working with newly arrived migrants, such as language barriers and insurance issues. What's your response to that?
Thanks so much, Patrice. And thanks again for having us. So we acknowledge that, seeing a migrant patient on one schedule or in the emergency department or in the hospital can be overwhelming. Often it feels like, where do I start in trying to care for this patient? I want to first share that we're really lucky to live in a state like Massachusetts, where at least everyone can be insured at some basic level. So even undocumented immigrants here in Massachusetts can receive a limited form of our Medicaid, which is Mass Health Limited, along with Health Safety Net. So they can access preventative services at a community health center or a hospital site, including medications at a 340B pharmacy or a nonprofit pharmacy. And here at Mass General Hospital, our main pharmacy on Wang 1, and also our pharmacies in Revere and Waltham are 340B pharmacies. In general, they can also access emergent services with that Mass Health Limited and Health Safety Net kind of insurance, and come into the emergency department. And there's also a financial assistance policy at Mass General Brigham that requires all specialists to see these patients as well. And so definitely reach out to us at the MGH Center for Immigrant Health if you as a provider feel, whether you're a community health worker or a physician or a nurse, feel that your patient is not receiving the care that they deserve because of pushback from a specialist on billing or because of other barriers to access. Additionally, I would say that we can field questions in this area on a case-by-case basis. And so we will include our general email address and often can then filter requests for services to Marcia, our community health worker, around some of these issues. And then we have an amazing interpreter services here at the hospital that's accessible by phone 24 hours a day for providers to work with one of our staff interpreters or one of the language lines, so that we are always, as Marcia said, communicating in the preferred language for a patient.
Fantastic. Fiona, kind of piggybacking off of that, can you talk a bit more about the work being done in the policy space?
Sure, absolutely. So I think our advocacy occurs at multiple levels. It starts here within our own hospital. And that can look like many things. We were involved in the development of the new patient code of conduct that folks may have seen go out in their emails to make sure that no staff member will feel discriminated against on the basis of their national origin or their preferred language that they speak. We have also been involved in helping Mass General Brigham to conduct outreach with our patients so that they understand their rights. For example, during the 2020 census, when there was an effort to include a citizenship question on the census, which may have deterred a number of immigrants from participating, we worked with MGB to put together information for patients, reassuring them of the safety of participating in the census and of voting if they had the right to do so, and included that material in the packets that went out at the COVID-19 clinics. And, at the city level, we've been very involved in talking with the Mayor's Office for Immigrant Advancement and other organizations about how to respond to the increase in new arrivals to make sure that everybody gets the resources that they need and can get connected to care. At the state level, we have been very actively involved in advocating for several important bills, including the Work and Family Mobility Act, otherwise known as the Driver's License Bill, which was passed this summer, which would enable immigrants, regardless of immigration status, to obtain a driver's license if they meet the other requirements. This is something that we saw really affect our patients during the COVID-19 pandemic. They were not able to access vaccines and treatment readily if they didn't have access to private transportation. And that was part of what played into the rate of illness among the immigrant patients who ended up in our inpatient units. So we're very grateful to MGB for supporting this legislation, and it survived the recent referendum and will go into effect in July of next year. Similarly, we've advocated for the Language Access and Inclusion Act and for the Cover All Kids bill, which would help to expand access to full mass health standard for immigrant children, regardless of immigration status. And at the federal level, we've also been involved in a number of issues. We have worked with MGB around advocating for the public charge rule to go back to its previous iteration that was far less intimidating to immigrant families in accessing the services that they need and to which they are entitled. We've also worked with the institution around legislation or supporting legislation that is supportive of DACA recipients. And we have been involved in testifying before Congress about issues like medical deferred action, which help to make sure that immigrants can remain in the country to seek life-saving medical care when needed, and around the deaths of several children in Customs and Border Protection custody.
That's great. So from all of your responses, I'm really hearing a lot about the importance of community. And we received a comment in the Q&A, which I think really speaks to that. So somebody in our Q&A had written, I was recently at the groundbreaking for the new buildings. I was so happy to hear President David F.M. Brown, MD, use the Mass General catchphrase, when in distress, every person becomes our neighbor, which was the same quote that you showed, Fiona, on the last slide. Do you guys want to chime in on what that quote means to you and what it means in the landscape of the times that we're in?
I suppose I can go first. Yes, I think this brings us back full circle to what you said at the very beginning, Patrice, that we live in very polarized times where there is sometimes an effort to divide people based on pretty arbitrary identifiers and to turn people against each other for the sake of advancing a political agenda. And that's incredibly harmful, not just to people's mental health, but to their physical health as well. And it's something that we feel very strongly that we need to advocate against. And that the most important thing that we can do as an institution of healing is to welcome people from all walks of life. It doesn't matter what piece of paper they have in their back pocket. We recognize the humanity of every member of our community.
Great. Marcia, Rashmi, do you have any thoughts? Anything you'd like to add?
Go ahead, Marcia.
Sure. Working as a community health workers, I see it every day working with so many staffs here at the hospital and outside as well. How many resources come together, how many staff members, exchanging knowledge and experience, and how much of I see how much of the community resources are needed, but also how much more we also need as well. But when the stress, we are a big family. We all need to support each other, communicate very well. And I see it every day working with everyone within the hospital and also outside.
And I just want to add two things. I think that, we have seen how instrumental it's been to partner with the community organizations who really are on the front lines working with new migrants and other populations who've been structurally disadvantaged. And I think, that's one way we have been able to reach out to these populations in distress, is really bolstering the work of people who are dealing with this day in, day out. And also as a hospital system, I do think we're uniquely positioned. When people are in distress, they come to our emergency department. They come to spend the night here because they don't have access to housing. And I think what we're seeing for our new migrant populations is symptomatic of what's causing distress amongst our community in general. And often now that we're seeing it in this new migrant community, it's sort of a sentinel of like, wow, housing's a real big problem right now here in Massachusetts and in Boston in particular, or food insecurity, both of which, really were highlighted in the pandemic and have continued to be major issues even after that. And I think seeing that amongst our most newly arrived members of this community, which we're aiming to help, just highlights how that's been an issue for everyone.
Thank you. So earlier you all referenced Migration is Beautiful in the campaign. Do you have a date or events locked in for this upcoming year?
Yes, thank you for that question. So Migration is Beautiful happens every December. As I mentioned, it is centered around December 18th, which is the United Nations International Migrants Day. This year, the dates for our campaign are December 12th to December 16th. We will be tabling that Monday and Friday in the main corridor at MGH. So please stop by to get butterfly stickers for your ID badges. Hopefully we'll have the badge backers there, lots of information for folks, and we'll have a lineup of events as well. So stay tuned for more information coming through your email soon.
Awesome. Well, thank you so much to our presenters for their responses to these amazing questions. Thank you to everybody who submitted a question in the Q&A. If you have additional questions or want to learn more about the work of our panelists in the center, please do reference the chat and the links that you see there. So that concludes this month's Front and Centered. Next month, the Center for Immigrant Health, as we mentioned before, will kick off its annual Migration is Beautiful campaign as part of a nationwide movement to celebrate the resilience and courage of those who come to the U.S. seeking better opportunities and lives. We hope that you can use what you've learned today to inform your work and better support the diversity of our patients and our communities. In our next Front and Centered webinar on December 29th, we'll be discussing the work of our youth programs and hope that you'll join us. Stay tuned for more information and look for updates on our Apollo page. Until then, we'll see you and we hope that you take care. Thank you all for attending today's webinar.